Blepharoplasty, the actual anatomy of what we do. Here's a right eye straight on, and here's the eye from the side. So when patients come in looking for an upper eyelid blepharoplasty, where are we making the incision? The incision gets marked out here, across to here, and we take a little bit more out laterally to really lift this upper eyelid. This is where we remove that skin. For the lower eyelid, we make the incision down here, we extend out a little bit, we remove that skin. What does that look like on the side view? Here's the upper eyelid, lower eyelid. So we want to remove the skin, but we may also need to remove some of the muscle. We make the incision about 1 centimeter up from the lash line, and that's where we make the incision in. And how do we figure out how high up do you go? We pinch it. We make sure that the patient can still close their eye, but we pinch that together, and that'll tell us how much skin we can remove, and then all of that will be removed. Sometimes we go down and we also take a small layer of the muscle, and then all that gets sutured together, which lifts up the eyelid. On the lower eyelid, we similarly make an incision just underneath the lash line, and we'll go down 3 or 4 millimeters to remove that amount of skin. And if we need to take out a small amount of muscle, we can do that as well. This is the anatomical way that we do an upper and lower eyelid blepharoplasty, and then we'll show you on a real patient what it looks like. The upper eyelid skin is excessive and hanging down and drooping and gives patients the appearance that they're very tired. So here's a patient before. You can see she has a lot of hooding on this upper eyelid. She has wrinkles going out laterally, and down on her lower eyelid, she has excess skin. Because she is constantly doing this, she has these rhytids up here. Here she is postoperatively. You can see a refreshed and improved appearance on her lower eyelid. She no longer has these upper eyelid wrinkles, and out laterally, these wrinkles have been addressed. Let's take a deeper dive. Here's the patient preoperatively, and you can see the markings that we made for the amount of tissue that we plan to excise. This small dot is her midline so that everything can be symmetric. For her lower eyelids, that's the planned amount of skin excision from her lower eyelid. So here we can see her before pictures and here her after pictures about 6 months later. You can see a dramatic improvement in her lower eyelids. All of these rhytids and wrinkles have been addressed. Scars are virtually undetectable. Dramatically improved lower eyelid, dramatically improved color and consistency of her skin, as well as resolution of all of the skin rhytids and the excess overhanging skin. Upper and lower eyelid blepharoplasty.